High blood pressure, also known as hypertension, is a prevalent condition characterized by elevated blood force against the walls of your arteries. Arteries serve as the conduits for blood to transport oxygen and nutrients away from your heart to nourish your body's tissues. Within your heart, two chambers called ventricles contract rhythmically with each heartbeat, propelling blood to your lungs and through your arteries. As blood courses through these vessels, three primary factors influence the pressure exerted on the artery walls. The first factor is cardiac output, referring to the volume of blood that your ventricles expel from the heart per minute. An increase in cardiac output correlates with elevated blood pressure. The second factor affecting blood pressure is blood volume, which signifies the total amount of blood within your body. An increase in blood volume is associated with higher blood pressure. The third factor influencing blood pressure is resistance, which encompasses anything that hinders the flow of blood through your arteries. Resistance is influenced by various factors. The elasticity of your artery walls is one such factor. Healthy arteries expand during each heartbeat to alleviate pressure on the walls. Another determinant of resistance is the diameter of your arteries. Your body can adjust artery diameter to either lower or raise blood pressure as needed. Blood viscosity or thickness constitutes the third resistance factor. More particles like proteins and fats in your blood increase viscosity, which in turn elevates blood pressure as the heart must work harder to propel the thicker blood through the arteries. 2. Measure blood pressure. A device known as a sphygmomanometer or blood pressure cuff is utilized. Blood pressure has two main components: systolic pressure, which is the pressure during a heartbeat, and diastolic pressure, which is the pressure between beats. Typically, systolic pressure should be less than 120 millimeters of mercury, while diastolic pressure should be less than 80 millimeters of mercury. Consistently high systolic pressure above 140 or diastolic pressure above 90 indicates hypertension. Over time, untreated hypertension can lead to damage to the artery walls, potentially causing aneurysms, bursts, or plaque buildup, which can obstruct blood flow and form clots, increasing blood pressure and posing severe health risks. Artery damage and reduced blood flow can lead to conditions such as strokes, heart attacks, or kidney disease. In most cases, the cause of hypertension, referred to as primary or essential hypertension, remains unknown. Treatment for essential hypertension typically involves lifestyle modifications, including adopting a healthy diet and, if sensitive to sodium, reducing salt intake. Other lifestyle changes include limiting alcohol, engaging in regular exercise, losing excess weight, and quitting smoking. Additionally, medications may be prescribed by your doctor to target your kidneys, blood vessels, or heart, reducing blood pressure. Diuretics help your kidneys excrete salt and water, thus reducing blood volume and pressure. Beta blockers reduce the workload on your heart, while various drugs relax blood vessels to widen their diameter, including ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, and direct-acting vasodilators. If you found this information helpful, please consider liking this video and sharing it with others who may benefit from it.